What if the right vitamins could do more than just fill a nutritional gap? What if they could actually help lower your blood sugar, protect your nerves, strengthen your heart, improve insulin sensitivity, and even protect your eyes and kidneys from long-term diabetic complications? In this video, we're uncovering the 10 most powerful vitamins that every diabetic needs to know about. Some of these are hiding in everyday foods, while others are often overlooked but could change the way you manage your blood sugar for good. Stay tuned, because by the end of this video, you'll discover exactly which vitamins to focus on, how much you really need, and how each one can help protect your body from the inside out. First on list, vitamin D. Vitamin D isn't just the sunshine vitamin. It's a vital player in your body's ability to regulate blood sugar, protect nerves, and support the immune system. For people living with diabetes, especially type 2, vitamin D deficiency is surprisingly common and often overlooked. One of the earliest signs of deficiency is unexplained muscle weakness or bone pain, especially in the legs, back, or hips. Other red flags can include frequent infections, slow wound healing, and even mood changes like depression or brain fog. The causes behind this deficiency are often a mix of factors: spending too much time indoors, using sunscreen all the time, having darker skin, which naturally reduces vitamin D production, or being overweight, since vitamin D is fat-soluble and can get trapped in fat cells instead of circulating in the blood. For diabetics, poor kidney function can also impair the body's ability to convert vitamin D into its active form, making supplementation even more critical. Studies show that low levels of vitamin D are linked to higher insulin resistance, increased inflammation, and even nerve damage over time. That's because vitamin D helps your pancreas release insulin properly, improves insulin sensitivity in muscle cells, and reduces chronic inflammation that can worsen diabetic complications like neuropathy and kidney issues. A typical daily intake for diabetics is around 800 to 1,000 IU of vitamin D, though some may need higher doses based on individual needs. Always check with your doctor. You can get vitamin D from fatty fish like salmon or mackerel, fortified dairy products, and a little sunlight, about 15 to 20 minutes a few times a week. But here's the catch. Over 40% of people with diabetes in the US have insufficient vitamin D, and symptoms like fatigue, muscle weakness, and slow wound healing are often ignored. Did you know that one study found people with low vitamin D had up to a 40% higher risk of developing diabetic neuropathy? A simple vitamin D test and proper supplementation could make a major difference in protecting your nerves, heart, and immune system. And here's a quick tip. Pair vitamin D with healthy fats like olive oil or avocado to boost absorption. Second on list, vitamin B1, thiamine. Vitamin B1, also known as thiamine, is like the ignition switch for your body's energy system. For diabetics, this vitamin is especially important because it helps the body convert carbohydrates into energy efficiently, keeping your blood sugar from spiking and protecting your nerves from damage. One of the earliest signs of vitamin B1 deficiency is burning sensations or tingling in the feet and hands, which can be an early clue of diabetic neuropathy. Thiamine deficiency is often caused by a high intake of refined carbs like white bread and sugary snacks, alcohol consumption, certain medications like diuretics, and even chronic stress. Studies have found that up to 75% of diabetics have low thiamine levels, which can make nerve pain, fatigue, brain fog, and even heart problems worse over time. Thiamine helps regulate an enzyme called transketolase, which plays a key role in preventing oxidative stress, a major contributor to diabetic complications like kidney damage and retinopathy. It also helps lower advanced glycation end products, AGEs, which are harmful compounds that build up in the body when blood sugar stays high for too long. A typical daily intake is around 1.1 to 1.2 milligrams for adults, but diabetics may need more to support nerve and heart health. You can get thiamine from foods like whole grains, sunflower seeds, pork, and legumes like lentils and beans. Here's a tip. Cooking these foods gently, like steaming or light sautéing, helps preserve their thiamine content. Did you know one study found that thiamine supplementation could improve nerve function by up to 42% in people with diabetic neuropathy? That's a powerful reminder that even a small nutrient can have a big impact. And When it comes to thiamine, your nerves will thank you for paying attention. Third on list, vitamin B6, also known as pyridoxine, is a powerhouse for diabetics because it supports nerve health, regulates blood sugar, and helps reduce inflammation, all critical for managing the complications of diabetes. One of the earliest signs of vitamin B6 deficiency is numbness or tingling in the hands and feet, a warning sign that your nerves are struggling. Other symptoms can include mood changes, irritability, or even cracks at the corners of the mouth. Deficiency often occurs due to a poor diet, alcohol use, certain medications like isoniazid or hydralazine, and chronic kidney issues, which are common in long-term diabetes. B6 is deeply involved in over 100 enzyme reactions in the body, including the production of neurotransmitters like serotonin and dopamine, which regulate mood and nerve signals. For diabetics, B6 helps reduce the buildup of homocysteine, a compound that can damage blood vessels and increase the risk of heart disease. It also supports the synthesis of hemoglobin, helping to prevent anemia, and plays a key role in glucose metabolism by supporting enzymes that process carbohydrates. A typical daily intake is around 1.3 to 1.7 milligrams for adults, but diabetics may benefit from slightly higher amounts to support nerve and cardiovascular health. Good food sources include chickpeas, salmon, chicken breasts, fortified cereals, and bananas. Light cooking methods like steaming or baking help retain B6 content in these foods. Interestingly, research shows that B6 supplementation may reduce the risk of diabetic complications like neuropathy by up to 30%, a significant difference that highlights its importance. Adding B6-rich foods to your meals isn't just good for your nerves. It's a smart strategy for managing diabetes naturally, one bite at a time. Fourth on list, vitamin B12, cobalamin. Vitamin B12, or cobalamin, is like a protective shield for your nerves, blood cells, and brain, making it an essential nutrient for anyone managing diabetes. One of the first signs of vitamin B12 deficiency is tingling or numbness in the hands, legs, or feet, which can easily be mistaken for diabetic neuropathy. This overlap is critical because B12 deficiency itself can mimic or worsen diabetic nerve damage, making early detection and correction vital. Diabetics, especially those on long-term metformin therapy, are at higher risk of B12 deficiency, as metformin can interfere with B12 absorption in the gut. Other causes include aging, certain stomach conditions like atrophic gastritis, or following a strict vegetarian or vegan diet without supplementation. B12 is involved in DNA synthesis, red blood cell production, and the maintenance of the myelin sheath, the protective covering around nerves. Without enough B12, nerves can fray, leading to pain, numbness, and even cognitive problems like memory loss or confusion. For diabetics, low B12 can worsen neuropathy, increase the risk of heart disease, and impact mood stability. The recommended daily intake is 2.4 micrograms, but many diabetics may need more, especially if they are taking metformin. Good sources of B12 include animal products like beef liver, clams, salmon, tuna, eggs, and dairy. Since B12 is sensitive to cooking, it's best to use gentle methods like steaming or poaching to preserve its potency. Research shows that B12 supplementation in diabetics with neuropathy can improve nerve function by up to 50%, reducing pain, numbness, and weakness. That's a powerful reminder that protecting your nerves isn't just about blood sugar control. It's also about making sure you have enough B12 to keep your nervous system running smoothly, your energy high, and your brain sharp. Before we move on, I'd love to know, where are you watching from today? Let me know in the comments below. Now let's continue and explore the next important vitamin for diabetics. Fifth on list, vitamin C. Vitamin C is often seen as just the immunity vitamin, but for diabetics, it's much more. It's a powerful antioxidant that helps reduce inflammation, protect blood vessels, and improve insulin sensitivity. One of the earliest signs of vitamin C deficiency is frequent bruising, bleeding gums, or slow wound healing, which can be easily overlooked in diabetes but may signal trouble. For diabetics, the risk of deficiency is higher because chronic high blood sugar levels can cause vitamin C to be used up more quickly in the body. Smoking, stress, infections, and a poor diet can also deplete vitamin C stores. Vitamin C works by neutralizing free radicals, unstable molecules that damage cells and contribute to complications like neuropathy, retinopathy, and kidney disease. It also supports the production of collagen, a protein that keeps skin, blood vessels, and connective tissues strong, which is crucial for healing diabetic ulcers and protecting heart health. Vitamin C may even help lower HbA1c levels by improving glucose metabolism and reducing oxidative stress. The recommended daily intake for adults is around 75 to 90 milligrams, but many experts suggest diabetics may benefit from higher intakes, up to 500 milligrams per day from food and supplements combined. Good sources include bell peppers, strawberries, oranges, broccoli, and Brussels sprouts. Light cooking, like steaming, helps preserve vitamin C better than boiling. Here's an interesting fact. One study found that vitamin C supplementation could reduce fasting blood sugar levels by up to 30% in people with type 2 diabetes over 4 months. That's an impressive impact for such a simple nutrient. By adding more vitamin C-rich foods to your diet, you're not just boosting immunity, you're actively protecting your heart, nerves, eyes, and skin from the hidden dangers of high blood sugar. Sixth on list, vitamin E. Vitamin E is often called the cell protector for a good reason. This powerful antioxidant helps shield your body's cells from damage, especially in diabetes, where oxidative stress runs high. One of the earliest signs of vitamin E deficiency is muscle weakness or balance problems, which happen because the nerves are struggling without this protective nutrient. In diabetics, deficiency is often caused by chronic inflammation, poor absorption of fats, since vitamin E is fat-soluble, or long-term use of certain medications like statins. Vitamin E plays a critical role in stabilizing cell membranes, reducing inflammation, and improving blood flow. Key factors for preventing complications like neuropathy, heart disease, and vision problems. It also supports healthy insulin function by reducing oxidative damage to pancreatic beta cells, which are responsible for producing insulin. Studies suggest that vitamin E can help improve nerve function and even reduce the risk of diabetic retinopathy, a leading cause of vision loss. The recommended daily intake for adults is around 15 milligrams, 22.4 international units, but many diabetics may benefit from slightly higher amounts, especially if they have signs of oxidative stress. Good food sources of vitamin E include almonds, sunflower seeds, spinach, avocado, and olive oil. Since vitamin E is sensitive to heat, it's best to add these foods raw or lightly roasted. Think a tablespoon of sunflower seeds sprinkled over a salad or a drizzle of olive oil on steamed vegetables. One study found that vitamin E supplementation could improve nerve conduction velocity by up to 30% in diabetics, which means better nerve signal transmission and reduced pain or numbness. By prioritizing vitamin E-rich foods, you're not just protecting your nerves, you're giving your body a fighting chance against the silent inflammation that drives so many diabetic complications. Seventh on list, vitamin K2. Vitamin K2 is one of the most overlooked vitamins when it comes to diabetes, yet it plays a powerful role in protecting your arteries, bones, and even insulin sensitivity. One of the earliest signs of vitamin K2 deficiency is easy bruising or bleeding, but in diabetics, a more hidden sign is the gradual buildup of calcium in the arteries, a condition called vascular calcification that silently increases the risk of heart attacks and strokes. The deficiency often happens because most diets are low in K2-rich foods like natto, fermented cheeses, or pasture-raised eggs, and the body doesn't easily convert vitamin K1 from leafy greens into the active K2 form. For diabetics, this is critical. Vitamin K2 helps direct calcium into the bones and teeth, where it belongs, and away from soft tissues like arteries and kidneys. This not only keeps your heart healthy, but also supports insulin sensitivity by reducing inflammation and improving glucose metabolism. Research shows that people with higher vitamin K2 intake have a significantly lower risk of developing type 2 diabetes, up to 20% lower. K2 also helps protect kidney health, as calcification in the kidneys can lead to worsening diabetic nephropathy. The recommended intake of vitamin K2 is not clearly established, but studies suggest that 90 to 120 micrograms per day is beneficial, with higher intakes offering more protection. Good food sources include natto, a fermented soybean dish, aged cheeses like Gouda and Brie, egg yolks, chicken thighs, and grass-fed dairy products. Since vitamin K2 is fat-soluble, pair these foods with healthy fats like avocado or olive oil for better absorption. By adding more vitamin K2 to your meals, you're not just protecting your bones. You're building a natural defense system against the silent damage of diabetes, keeping your arteries clear, your heart strong, and your insulin working the way it should. Eighth on list, vitamin B9, folate. Vitamin B9, better known as folate, is like a silent guardian in your body, working behind the scenes to protect your heart, nerves, and brain, all critical for diabetics. One of the earliest signs of folate deficiency is feeling unusually tired or weak, often accompanied by a pale tongue, irritability, or even mouth sores. This can happen because folate is essential for producing red blood cells, and a deficiency leads to a type of anemia that leaves you drained. Diabetics are at higher risk of folate deficiency due to poor dietary intake, certain medications like metformin or methotrexate, and increased needs during periods of stress or illness. Folate plays a vital role in breaking down homocysteine, a harmful compound that, when elevated, can damage blood vessels and increase the risk of heart attacks, strokes, and kidney problems. For diabetics, folate helps lower homocysteine levels, reducing the risk of cardiovascular disease, supporting healthy nerve function, and aiding in the repair of damaged tissues. It also plays a role in DNA repair and supports a healthy metabolism. The recommended daily intake for adults is around 400 micrograms, but diabetics may benefit from slightly higher intakes to combat homocysteine buildup and protect their organs. Good food sources include leafy greens like spinach and kale, lentils, black beans, avocados, and fortified cereals. Folate is heat sensitive, so it's best to lightly steam or saute these foods rather than boiling them. Did you know that one study found folate supplementation could lower homocysteine levels by up to 25%, reducing the risk of heart disease in diabetics? That's a significant impact for such a simple nutrient. By ensuring you get enough folate, you're not just helping your heart, you're actively fighting against diabetic complications from the inside out, one nutrient at a time. Ninth on list, vitamin A, beta-carotene. Vitamin A, especially in its plant-based form, beta-carotene, is a key nutrient for diabetics because it protects the eyes, supports immunity, and helps control inflammation that can worsen diabetic complications. One of the earliest signs of vitamin A deficiency is night blindness or difficulty seeing in low light, a warning sign that your retina isn't getting the support it needs. Diabetics are at higher risk of vitamin A deficiency because chronic high blood sugar can impair how the liver stores and activates vitamin A, and oxidative stress can deplete this vital nutrient faster than usual. Vitamin A is crucial for maintaining the integrity of the retina, reducing the risk of diabetic retinopathy, a condition that affects nearly 30% of people with long-term diabetes. It also supports immune function by helping the body create white blood cells that fight infections, a critical defense for diabetics whose immune systems can be weakened by chronic inflammation. Beta-carotene, the plant form of vitamin A, acts as a powerful antioxidant, helping neutralize free radicals and protect the heart, kidneys, and nerves from damage. The recommended daily intake for vitamin A is about 700 to 900 micrograms ERAE, retinol activity equivalents. But most people get it from a mix of preformed vitamin A in animal products and beta-carotene in colorful fruits and vegetables. Carrots, sweet potatoes, spinach, kale, and cantaloupe are all rich in beta-carotene, and adding a little healthy fat, like olive oil, when cooking helps your body absorb it better. Here's an amazing fact. One study found that higher beta-carotene intake was linked to a 37% lower risk of developing diabetic retinopathy, a powerful reminder that your food choices can protect your vision in the long run. For diabetics, keeping vitamin A levels in check isn't just about better eyesight, it's about guarding your body against silent, progressive damage from high blood sugar, one meal at a time. 10th on list, vitamin B7, biotin. Vitamin B7, also known as biotin, is often called the beauty vitamin for its role in healthy skin, hair, and nails. But for diabetics, it's much more than that. One of the earliest signs of biotin deficiency is hair thinning or brittle nails. But for diabetics, the real danger lies in its impact on blood sugar. Biotin helps regulate enzymes involved in carbohydrate metabolism, allowing your body to use glucose more efficiently and improving insulin sensitivity. Deficiency can happen due to long-term use of antibiotics, certain anti-seizure medications, or even a high intake of raw egg whites, which contain a protein called avidin that binds to biotin and prevents absorption. In diabetics, biotin levels tend to run low because chronic blood sugar spikes increase the body's need for this vitamin. Studies have shown that biotin can help reduce fasting blood glucose and improve insulin function, offering a natural way to manage type 2 diabetes alongside other treatments. The recommended daily intake is around 30 micrograms, but research suggests that much higher doses, up to 5,000 to 10,000 micrograms, may have therapeutic benefits for blood sugar control and nerve protection, though these higher doses should only be taken under medical supervision. Good sources of biotin include eggs, cooked, not raw, almonds, walnuts, salmon, sweet potatoes, and spinach. Since biotin is water-soluble, cooking methods like steaming or baking preserve its content better than boiling. Here's a fascinating fact. A study found that combining biotin with chromium picolinate improved blood sugar control by up to 35% in people with type 2 diabetes. That's a powerful tool for anyone managing blood sugar naturally. By adding biotin-rich foods to your diet, you're not just supporting your hair and skin, you're also helping stabilize your blood sugar, protect your nerves, and reduce the risk of long-term diabetic complications. Final thought. When it comes to managing diabetes naturally, the right vitamins can make all the difference. By choosing foods and supplements that support nerve health, heart function, insulin sensitivity, and blood sugar balance, you're not just treating a condition, you're building a stronger, healthier body from the inside out. Remember, managing diabetes isn't just about what you avoid, it's about what you add to your plate. Every small change matters. So start today by adding these powerful vitamins to your daily routine and see how they transform your energy, protect your nerves, and even help reduce the risk of complications. Stay committed, stay informed, and stay healthy. And if you found this video helpful, don't forget to like, share, and subscribe for more science-based, practical tips on living well with diabetes. Stay healthy and take care of yourself, because you deserve to thrive, not just survive.